A program very close to my heart personally, polio eradication. We have with us at the regional committee in Khartoum, the manager of the polio eradication program in EMRO, Maher.
Hi, Ibrahim. How are you?
How are you? So where are we from polio eradication now? I mean, in our region first.
If I compare it, I remember you and I talked last year at the regional committee, and we were looking at the situation then. We still have Pakistan and Afghanistan as countries in the region that are infected and reporting wild poliovirus cases.
Okay.
They're finding wild poliovirus in environmental specimens as well as in children who are paralyzed.
So there hasn't been any advance at all?
I would say there's been an advance in terms of the quality of the programs in the two countries. I think both countries have stronger programs than they had before.
And they have the teams.
They're very robust teams, and they have national emergency action plans that they implement.
I am personally curious. What is it that is impeding that we would get there in Afghanistan and Pakistan?
Well,
besides the emergencies.
That's sort of the $64 million question. Everyone wants to know that. And I think in every country where we've gone through the eradication process, at the end we've kind of been asking ourselves the same question: how come virus is still hanging on? You know, just before we've reached the stage where we eradicate.
We're nearly there.
I think in Afghanistan and Pakistan you have a very complex situation. Afghanistan in particular, because there's conflict, and you know, parts of the country are not under the direct control of the government; they're under the control of
so it's a classic example of what emergencies and
other local authority groups. So yeah, it's not always easy to access all children with immunization, and it's a very, if you see the situation in Afghanistan, it goes up and down quite a bit. You can have some immunization campaigns where it's very good, you can access lots and lots of kids, and then 2 months later you have one where suddenly you can't access 1 million children. So that sort of variability is a problem. Another very big problem is population movement, because for both countries,
because of the conflict,
really high level,
and
even normally and naturally, Pakistan has very high levels of population movement. People move all over the country, and this is a very, you know, obviously if there's virus around, it can be moved very easily by population.
But Nigeria, there's been a definite advancement.
Nigeria, touch wood, no wild poliovirus detected now for 2 years. Nothing detected for 2 years. So that's, globally, that's very good news.
You must be planning now worldwide what will happen to all these institutions, all those trained people, what will happen to them once we eradicate polio?
Yeah, this is what's being referred to as the polio transition process. So a lot of experience has been developed on polio eradication, and there's a lot of people working, WHO, UNICEF, for governments on polio eradication, and a lot of processes that have been developed, the surveillance system, the laboratory system, all of these things. And the general consensus, I think, is that we don't want to let these things disappear. Once polio is eradicated and we certify eradication, we don't suddenly want to lose all this.
So there is a transition plan.
We want to find a way of using these assets effectively to strengthen other public health programs. And that planning process is going to be different country by country, of course, because the circumstances are different. But the process has started now, and it's moving.
If I were to ask Maher, as manager of the polio eradication program, what would your wish be for Pakistan and Afghanistan? And talk to the camera and let me know.
We would love it if every child in Pakistan and Afghanistan could be reached with immunization, every family ensured all their kids were immunized every time polio vaccine was offered, so that we can eradicate polio as quickly as possible.
It seems to me it comes from the heart.
Thanks very much, Ibrahim.
Thank you.
Thank you.